Hello, my name is Vanessa Lathan, she, her, hers, and I am the Senior Program Manager for the Southern HIV Impact Fund at AIDS United. In 2016, funders concerned about AIDS convened a group of funders interested in a collaboration to leverage a funding impact on the HIV epidemic in the Southern United States for communities of color. This pooled fund and coordinated approach intentionally focuses on HIV care and prevention services, advocacy and movement building, and leadership development efforts in the South for communities of color. AIDS United honors Trans Awareness Week and Trans Day of Remembrance. AIDS United and the Southern HIV Impact Fund are committed to using our platforms to uplift and provide a safe space for transmasculine folk and trans men, particularly Black transmasculine folk living in the United States within the South. I would like to welcome to the virtual Southern HIV Impact Fund stage, Quinton Reynolds, he, him, his, founder and executive director of Game Changing Men. Game Changing Men is a grantee of the Southern HIV Impact Fund. Game Changing Men, located in the Metro Atlanta area, has been working throughout the South to erase stigmas and barriers for the progression of Black transmasculine men in society. Quinton will host conversations throughout this week. You will learn about the excellent events Game Changing Men has hosted across the South, the importance of consistent transmasculine visibility, and reproductive health, sexual health, and HIV among trans men and transmasculine folk. I hope you enjoy the conversations.
Thanks for that intro, Vanessa. And thanks everybody for watching this. So I'm Quinton Reynolds, the Executive Director for Game Changing Men. So I just want to talk a little bit about what Real Talk on the Road was and how the campaign came about. So last year we did a survey supported by the same grant, the SHIF grant through AIDS United. In the survey, we found that transmasculine folks particularly lacked access to reproductive health services and sexual health services. And so particularly 90% of the folks that answered the survey were from throughout the South. And so one of the things that we know that's lacking for trans men and transmasculine folks is data, access to reproductive health and sexual health resources, and also data and visibility around transmasculine folks in these areas. And so one of the things we wanted to do was to expound on the survey and go and listen to the people. And so one of the things that we did was we connected to state organizers in 11 states. One of the things that we also did was we wanted to provide resources and tools to folks while we had real conversations where we felt we could have bonding conversations that was in a safe space. But the first day, we know we needed to peel back a couple of layers. And so in order to do that, we hosted a meet and greet. And then the second day, we hosted more intimate conversation. Once some of those layers and stigma is peeled back and that keep us from having conversations that we need, especially around reproductive health and sexual health and transmasculine folks. And so Real Talk on the Road was created. We went to 11 states. And so I want to bring in Allyn Cropper, who actually organized, Allyn Cropper, I apologize, who actually organized our New Orleans, Louisiana stop. Allyn gonna come in and talk to us today about reproductive and sexual health in transmasculine communities, and particularly stuff that goes on in his state and how he's navigated some processes and the folks that he works with. Allyn is also the founder and executive director of My Brothers 2 organization. So welcome, Allyn.
Thank you.
So Allyn, thanks again for coming and being part of the panel, but also putting in all that hard work to bringing the folks in to have the much needed conversations and to really start figuring out some ways on how we can combat stigma in our community, but also how we can start to link us to the stuff and the resources that we really need to make sure we are living healthy lives and we're taking care of ourselves in the way that we should. And so, what was one of the biggest challenges, or what is one that you feel it was one of the biggest challenges surrounding HIV stigma for transmasculine and trans men, Black trans men specifically in our community?
I think one of the biggest stigmas is that trans men aren't affected by HIV. Whether it's directly or indirectly, we're still affected, being a part of the community and being lovers within the community. If I'm being completely honest, if the people that we love and we sleep with are affected, then so are we. And so that stigma in itself has done harm on all levels because there isn't any funding provided specifically for transmasculine individuals in regards to HIV care or work because we're not affected, so they say.
Yeah. And so I know when we try to organize as trans men, transmasculine folks to get other folks out, especially when it comes to HIV related events, or just to have conversations that's outside of things that are comfortable to talk about. What was it like organizing to try to get these guys out to come and to support something that was somewhat still taboo in our community and something that is a hush hush topic?
It was very hard. And I don't know if it's because of the topic itself or is they just didn't want to come out because they're not used to organizing. I mean, down here in particular, there isn't really a community. With a lot of the tragedies that have happened down here, from Katrina to just losing the only Black club that we had down here, there isn't much of a community in New Orleans. So organizing in New Orleans was pretty rough.
Yeah. And so we talked a little bit. So during the road stop there in New Orleans, we talked about sexual health, we talked about representation, we talked about reproductive health, and so you told me a little bit about your journey in reproductive health. I wonder if you will share a little bit about like what that's been like for you, as far as like access and care, and like how has the access been? Like how easy has it been? Like, and also like what that experience has been like when you're trying to access.
So for me, I'm a little different. I'm a veteran, so I have a VA, and the VA is very caring. There's a whole department dedicated just to trans soldiers and trans individuals within the VA. So it's a little different for me. So it wasn't as hard as it may be for some other people. Um, but from what I've heard from other people, it's very monopolized down here by maybe one or two organizations. And then it takes anywhere from 3 to 6 months to get seen. And that's just from, like I said, from what I've heard. It's not from firsthand experience. But my firsthand experience has been a pleasant one. But I've been navigating systems for 11 to 13 years. So it's a little different for me.
Yeah. I mean, you kind of spoke on like the resources available, and it definitely was brought up in our road stop there, the amount of resources that's accessible when it comes to for trans men, specifically when it comes to just want to get a checkup. And can you talk about that a little more about like some of some of the experiences we heard, and kind of what you try to help navigate, transmasculine folks in the community with having the resources that's available?
So it was two ends of that spectrum. It was one where they just weren't going because they didn't agree with the doctors that they had. and they didn't want to go to a place that was predominantly LGBT or for that stigma. They just wanted to go. So maybe they were living south or something like that, but they just wanted to go see a regular doctor. And then that doctor in itself, it was just a horrible experience. And they were more so educating the doctor. So then I think one guy said it's been 5 years since he's went or something like that. And then another guy, he just felt he didn't have to go because he wasn't having sex. And and in that moment, I felt it was a time to educate. Like that's not the only reason to go get checked up. Like there's other reasons why we need to get checked up and why we should have access to these resources. And I think overall it was just a great experience, great eye-opening experience for me, because then I realized more education needs to be done down here when it comes to resources, and not only just resources, but just maintaining yourself and your health and how important it really is.
With you navigate in Virginia is not really considered the South, but it's kind of close. So, but with you living in the South in New Orleans now, back in New Orleans, and you also, being in the military, accessing services and Virginia and other places, are you able to are there any differences that you've experienced when trying to seek service in different areas compared to like seeking services in New Orleans compared to other places?
Like I said, I'm with the VA. When moving to New Orleans is when I went with the VA, but before then I was active duty. In active duty, you have to go. There's no conversation about it. Every year you have to go. It's a part of your maintaining as a soldier. So it wasn't really a negotiable. However, I think transmasculine for transmasculine people, it's not broadcasted. It's not talked about. The education's not there. It's just we're kind of left to the wayside and figure it out ourselves once we transition. And I've had to educate a lot of younger guys that come after me and transitioning, and just talk to them about reproductive health and sexual health and all these things. Just having guy conversations. Like, all right, I know what you want to do, but I don't care what you do. It's how you do it, and we got to make sure you are healthy, and that's a part of your health.
Yeah. I think a lot of times when as I know for myself, when I transitioned, it was just like I had to the checkbox, right? And then I felt like I had to disassociate myself with any other thing from my former self. And I think sometimes that hinders us, especially when it comes to our health and stuff like that. Because a lot of times we don't get checked up. And it's sometimes a lot like other things, societal things, and all that stuff plays in the part. But then a lot of times it's those factors too. And I think we have to make space to have conversations about stuff like that with each other also. And so we have to also hold each other accountable, as well as like providers accountable and people that are having, that have reproductive health services or that have sexual health services. And speaking of like reproductive health, just to kind of round us up a little bit, in terms of reproductive health and reproductive justice, like what do you see as being reproductive justice, or what is the one thing or the one um, misbelief or myth that is associated with trans men and transmasculine folks when it comes to reproductive health? And you can answer either way or however.
I think the biggest thing is that we don't need it, or it doesn't encompass us just because we are transmasculine. For some reason, even though we may disassociate from those parts, it doesn't mean that they don't exist. It doesn't mean they don't need care for. I think that's one of the biggest myths, and maybe stigma, because I know that, okay, I know I can't speak from being in the military. I had to go to the women's health clinic, and it was pink. It was a pink lobby. It was a pink room, and I'm the only guy sitting in there. Like, but I had to get it done. I had to, it was something that I had to do, but it's uncomfortable. So I think that leads to not just comfort. Comfort in itself leads to those stigmas and leads to those issues of not wanting to be there. So the I guess let me get back on track. The misguidance is the misbelief is that we don't need it or we don't want it. And so it doesn't affect us. Because we want to have, some of us want to have our own kids. Some of us want to keep our parts. Like, we don't all want bottom surgery. So in those things, we need to have reproductive justice for us.
Yeah. I think reproductive justice is definitely all that. I think also a part of it, is tied into our sexual health and really making sure that we're taking care of ourselves. And Allyn, thank you for being here. As always, this conversation been good. And the road stop in New Orleans. Shout out to all the guys that came out. That was definitely a great conversation, a much needed conversation, and conversation that's going to continue on. But not only that, we want to make sure with this project and with this campaign that it continue on throughout the South to support Black trans masculine and Black trans men leadership. Also to bring more resources for us when it comes to sexual health and reproductive health, when it comes to representation in campaigns and HIV campaigns and care visuals and also reproductive visuals. And so, like they said, this will be a continual conversation. And this road stop that we doing, it's not going to stop here. And as always, Allyn, thanks, brother.
Thanks for having me.
Okay, we done.